Hello everyone, I'm Dr. Salman. Every week in my clinics in Islamabad and Peshawar, I get to see patients who went abroad to get a hair transplant. They come back and I get to see an overharvested donor, less growth, and a poorly designed hairline, which actually is a ruined hair transplant. It is very hard for me to correct because then I have to look at the remaining donor, whatever is left. The commonest problem is everything is taken out and it is put in the front. And then I don't have enough grafts to cover the remaining area. This is a very common problem. Today we'll talk about repair transplant rather than a hair transplant. All these are repairs where we try to give you the best possible result in whatever resources we have. If I do the hair transplant first, we always take care of the donor. But if the transplant has been done somewhere else, it's very hard to do the repairs. Now, the biggest tragedy that I see is overharvesting. I talk about mega sessions. I do giga sessions. But there is a reason and there is a way of doing that. It is not done with big punches. It is done with very small micro punches. Now the problem with overharvesting is if you do it with a big punch, you actually create a moth-eaten appearance. The follicle that you are taking is definitely extracted, but the surrounding follicle is damaged. That makes things very difficult for me to correct. Getting grafts from the same donor then is very, very difficult. Now the patient comes up and tells me that they did hair transplant for the hairline and the hairline is good. But what would I do with the area that is between the hairline till the type 7? That creates the problem. There are many celebrities currently in Pakistan who have this issue. They have gone to Turkey, they have gotten their hairline fixed, and in fixing that hairline, they have actually ruined the whole donor area. And then they come back, and how can I address that issue? I definitely have to go down to the beard. I have to go down to the chest. Those hair are never a replacement of the true hair that you have at the scalp. Now, if the donor area is depleted, there are certain options on how to cover that. First one is scalp micropigmentation. Some people want to go about it, some people don't like it, but that is one of the solutions to cover up that donor area. Because if I take further grafts, that's going to further reduce the donor area. Now the second problem, in order to get many patients, they would counsel the patients that we are going to take the doubles and triples and the quadruples and we are going to give you a great result in the front and the hairline. Now, it sounds very attractive when you as a patient go down to a clinic and they tell you that we are going to put in a lot of hair. It's not about putting a lot of hair, it's about putting the right number in the right way. If you put the doubles and the triples and the quadruples in the front, you'll definitely get a dense hairline. But that dense hairline is going to look very unnatural. Now what I have to do then? Pluck out those grafts. Remove the doubles and the triples because they point out. You're very obvious. And it is so hard to correct those hair because I cannot pluck out 1 out of 3. I have to take out the whole follicle. And when I take out the whole follicle, I have to replace it somewhere here. And even this part would leave a microscar. This unnatural hairline is such a major problem. And I'm very sorry to say, but I have seen that in all of the patients who have actually come back to me for a second session from Turkey. And why does that happen? Let me clarify it once and for all. It's not about that you have had your hair transplant in Turkey. You have had it from a technician in Turkey. You have had it from a non-doctor in Turkey. Whether that is in Turkey, whether that is in New York, whether that is in Pakistan, it's all the same. You need to consult a plastic surgeon. And a plastic surgeon would actually know where to fix the right hair. Now, even if that number is less, it's going to look very unnatural. Just as I said, many celebrities, I've refused them, and I refused them because I have no way to fix the hairline. The second problem with the hairline, they keep it very low. Now, as a patient, you don't know where the exact position of the hairline is. It's my job as a doctor to guide you. Now, who would be the best person to guide you? It would be a plastic and a cosmetic surgeon. He would guide you to the right position of the hairline because the hairline defines the whole face. It has to be the thirds, it has to be the right measurements, it has to be the right way, either a circular one or an M-shaped, the zigzags. How would those zigzags work? How would the singles and the doubles work? If you don't know about all of this and you go down to someone who is actually not a trained plastic surgeon, you will end up with these sort of ruined hair transplants, which needs a repair. And that repair is actually more like an overhaul of a complete engine. So it's never going to be as good as the new one. Now, whatever has been done is done. What would be the corrective strategy? That is important. A corrective strategy is actually based on how many grafts you're left with at the scalp, in the beard area, the neck area, the chest area. And then you look at the area which needs to be fixed and the hairline that needs to be repaired. Now, if I'm repairing the hairline, I might be taking off certain grafts, either with FUE. Now, with the microcephaly, we are able to do that with very minimal scarring, in fact, no scarring at all. Or if it is too low, then I might go with the laser to bring the hairline up to the appropriate location. If, for example, the donor area is exhausted, I'll be taking very few grafts, whatever I'm left with, and I'll try to cover the front, I'll try to cover the parting side, I'll try to give you a camouflage look to cover up most of the area. And I'll be adding definitely grafts from the beard and the chest. How difficult is this corrective surgery? Let me be honest as a surgeon. It's very easy to do the first surgery. It's very difficult to do the corrective surgery. That's why very few doctors in Pakistan will actually take up your case, especially the ones who are in business and they have big names, because ultimately it's about the reputation. But throughout, my patients have been amazing. Whatever I do, whatever repair I do, they're very thankful, and they keep telling everyone that if the result is thin or weak, it is because the first hair transplant actually failed, or it gave me a poor result, or gave me an unnatural hairline, or a misdirected follicles. Therefore, the corrective surgery always takes longer. There is more scarring, so it's difficult to get the grafts. And it is also more difficult for the hair to grow in a scarred bed. Because if you take big punches, take big grafts from here, you're going to make big incisions in the front. And those big incisions are going to give you bigger scars. But after all this, if you have had a bad experience abroad or here, we are there to help you out. Come and have a consultation. I always like to see the person face to face in a corrective surgery. It's very difficult to assess things with pictures and videos. So I always want the person to be there so I can see the donor, I can see the recipient, I can see what are the options, and then I'll definitely carve the best possible one for you. And I'll be very honest in telling you that this is something we can achieve, this is something which is doable, and this is something which is unrealistic and not possible. So book your appointments with my managers and subscribe to our channel for more informative videos. Thank you.